This is my community analysis presentation of Seminole Heights, located in Tampa, Florida. During this presentation, we'll discuss the history of Seminole Heights and analyze the structure of the community, population of the community, health-related resources and availability, environment, and government and public policy in regards to the health for the community. We'll also discuss the top 6 community health needs. Seminole Heights Historic District is located in Tampa. It is comprised of 3 areas: Old Seminole Heights, South Seminole Heights, and Southeast Seminole Heights. From this point on, all areas were referred to collectively as Seminole Heights. Seminole Heights' northern and western border is the Hillsborough River. The area's eastern border is comprised of 22nd and 15th Streets. The southern border is Martin Luther King Boulevard. In the early 1900s, many industries sprung up in Tampa's downtown area. North of downtown, Sulphur Springs was a popular tourist and weekend getaway for Tampa residents. Therefore, areas between downtown and Sulphur Springs became a popular place for people to live. Homes were affordable, and T. Roy Young developed Seminole Heights in 1911, causing a population boom. The depression and splitting of Seminole Heights by 275 in the 1960s caused an increase in crime, and the middle class moved away from the area. Tampa decided to revitalize the area in 1995. Various city projects have rejuvenated the area. Many non-chain eateries, bars, and breweries have opened. This attracted young professionals and their families. This has introduced an interesting dynamic. You find brand new bungalows of the more affluent residents next to dilapidated homes of long-term citizens who can't afford to repair them. Seminole Heights has well over 4,000 people per square mile, while Hillsborough County has only 1,082 residents per square mile. Seminole Heights is made up of mostly houses, but there are rental apartments. One apartment complex is the Oaks at Riverview. The Oaks is public assistance housing at its finest. Residents have many amenities, such as a gym and ample storage areas. The recently built Seminole Heights Public Library offers readers the opportunity to check out books and use computers for a small fee. There are many public elementary schools, 2 middle schools, and 1 high school. If someone is inactive in Seminole Heights, it's not due to the lack of parks. There are 10 parks or exercise facilities in the Seminole Heights area offering running trails, ball fields, gymnastics, and other exercise opportunities. Unlike surrounding areas, the public transportation system is pretty good through its Hart bus line. Many of the bus lines that service Seminole Heights run late. It connects people to the businesses downtown and all major hospitals. A monthly pass only costs $32. However, other bus lines stop running at 6 p.m., which limits employment opportunities to the downtown area for shift workers. Heartline also offers services for the medically needy, where they pick you up at your house and bring you to your doctor's appointments. The 2 leading causes of death in the Seminole Heights area are cancer and heart disease. Contributing to this is the fact that 25% of the area is African American, 31% is on public assistance, and 23% of the families are making $25,000 or less. African Americans have a high incidence of cancer. One example is colorectal cancer, where 29 per 100,000 of blacks come down with the disease, compared to 19 per 100,000 for whites. Also, more African Americans die from cardiovascular disease than any other race. They also are at more risk for diabetes, sexually transmitted disease, teen pregnancy, and many, many more diseases. Poverty is a strong risk factor for heart disease. Interestingly, lung cancer has decreased in higher socioeconomic populations, but has increased in the poor. This is due to the fact that many of the poor smoke to deal with the stress of being poor. They are also at risk for poor nutrition, bad housing conditions, teen pregnancies, drug use, and to complicate matters even more, they have poorer access to health care. Luckily, citizens in Seminole Heights have great access to health care. There are 4 hospitals with emergency rooms within a 5-mile radius, all reachable by bus. Also, there are 4 urgent care facilities within a 3-mile radius of Seminole Heights, 5 primary care physicians within Seminole Heights, and many, many, many more within a few miles of its borders. And as I stated before, fantastic public transportation to all facilities. Due to the Affordable Care Act, most facilities and doctors accept Medicare, Medicaid, and private insurance. Costs are determined by your insurance company. Those without insurance, of course, have higher costs and less quality of care. If people want to check out a facility to see if it's acceptable to them, they're able to view inspection reports through the website aca.myflorida.com. On to the 3 Healthy People 2020 community objectives that I feel most apply to Seminole Heights. The first is ECBP 10.7, which has increased the number of community-based organizations providing population-based primary prevention services for chronic diseases. The reason why I chose this is 3 of the top 5 causes of death in Seminole Heights are due to chronic disease. Hypertension and COPD, and also stroke, which usually stems from chronic hypertension. The second community objective is ECBP 2.7, increase the proportion of elementary, middle, and senior high schools that provide comprehensive school health education to prevent health problems in unintended pregnancy, HIV/AIDS, and STD infection. Reason why I chose this is that some of the top 5 of communicable diseases most prevalent in Seminole Heights are STDs. And the final community objective is ECBP-8, which has increased the proportion of work sites that offer employee health promotion programs to their employees. Reason why I chose this is health promotion programs are very effective in reducing the amount of smoking, fat intake, high blood pressure, and absenteeism, just to name a few. For such a large city, Tampa does enjoy pretty good air and water quality. Last year, Tampa only experienced 6 days of unsafe air quality for outdoor activity, according to the Environmental Protection Agency. Also, its waters had low contaminant levels, well below that's what was recommended by the EPA. One negative for the Seminole Heights area are there are a lot of busy streets, and I see many people walking on those roads, breathing in the carbon monoxide and other contaminants from the cars. This could lead to increased disability in the long run. Mayor Bob Buckhorn runs the city. There are 7 city council members that passed laws and ordinances that the mayor is obligated to carry out. They meet every first and third Thursday, and meetings are webcast and also shown on local TV stations. You could contact your representatives via email or phone. A couple of issues that the City Council is tackling currently are removal of Confederate statues and raising of property taxes, which haven't been done in 10 years. And now to discuss the 6 community needs. Primary prevention is a key to long-term health. Therefore, free health promotion classes that focus on the community's major problems will be a benefit. Some of the classes will be heart disease prevention, cancer screening importance, COPD, and venereal disease prevention. Increasing Affordable Care Act enrollment centers will benefit the community. People with government-sponsored health care have greater control of chronic diseases than those that don't have any health care at all. This is definitely the case in hypertension, which leads to heart disease and stroke. Outreach workers enrolled over 10 million people in 2014 alone, and we can locate them in churches or businesses. The third is to work with parents in the local area to increase play groups and free activities for children. Child obesity has grown in recent years and causes a variety of early diseases, such as diabetes. Community engagement helps improve childhood activity and individual habit change. Increased crosswalks and signal lights and pedestrian safety education would be a benefit to Seminole Heights. During my windshield survey, I found that jaywalking is an epidemic and there's long distance between crosswalks. Signalized lights seem to reduce speeding and unsafe crossing. Due to the increase of bars in the area, I believe free breathalyzer tests would be a benefit. Binge drinking leads to a variety of poor outcomes such as STDs, DUIs, and death. Finally, I feel there needs to be an increased awareness of free condom programs. Condoms reduce the spread of HIV and other STDs. Health Department and Planned Parenthood give out free condoms. Thank you very much for listening to my presentation, and I certainly welcome your feedback.